Insulin resistance and diabetes. What is the difference between insulin resistance and diabetes? And is insulin resistance the same thing as prediabetes? Today we're going to talk about 14 facts that you have to understand if you want to optimize your health or if you have loved ones who are wanting to improve any of these conditions. Stay tuned. I'm Dr. Ekberg. I'm a holistic doctor and a former Olympic decathlete. And if you want to truly master health by understanding how the body really works, make sure you subscribe and hit that notification bell so that you don't miss anything. Insulin resistance, prediabetes, and type 2 diabetes is what we're going to talk about today. The number one thing to know is that it affects 30 million people in the US. That's about 10% of the population with full-blown type 2 diabetes. Out of those people, 25% don't know that they have it. So as high as the numbers are, these problems are still underdiagnosed. Number two, 84 million people, another 84 million on top of that, have officially insulin resistance. That means that they are over 5.7 on the A1C. And out of all those people, 90% don't know that they have it. So even though they've done some research, they still don't understand really how big of a problem this is. And the people who have it don't know they have it, so they're not changing. They don't know to change anything. Insulin resistance is also called pre-diabetes or pre-type 2 diabetes because very often, or even typically, if you have insulin resistance, then within 5 years, it will have progressed to type 2 diabetes. So we need to understand that these are progressive mechanisms. We wear out the body. And if you want to get a true idea of how big this problem is, then understand that the number one cause of weight gain is insulin resistance. So it's not like every obese person has insulin resistance and every skinny person does not, but there's a pretty close correlation between the two. And officially, 87.5% of the people in the United States are overweight. So that should give you kind of an idea of how big this problem really is, that wherever we draw the line for what we're going to call insulin resistance, 87.5% probably have a significant degree of insulin resistance. Number 5, there is a big drive from official government agencies to identify, to diagnose the problem. But when people are identified and diagnosed and treated, then they add on average, if they get diagnosed at age 50, it will add on average $180,000 to $250,000 to their health care costs during a lifetime. And they will end up having an 8-year shorter lifespan than they would have without the diabetes. So there's the problem that, sure, we want to find out, we want to identify, we want to understand the problem, but even when they find it, it just becomes expensive and people still don't live normal, full lives. So getting it diagnosed and treated is not a fix in any way. Fact number 6, it is the number one cause of amputations of toes and feet and fingers and so forth. It is the number one cause of blindness, and it is the number one cause of kidney failure leading to dialysis. It is the number 7 overall cause of death, but once we understand that it is the causative factor, it's the primary causative mechanism in what's called metabolic syndrome or syndrome X, which essentially is associated with higher blood pressure, increased cardiovascular disease, and increased stroke, that it's basically the causative mechanism of all those conditions, then we understand that it's not really the number 7 cause of death. It is by far the number 1 cause of death because it's contributing to many of the other higher ranked conditions. When we look at the prevalence by age group, then we see that people between 18 and 44, only 4% have type 2 diabetes. And that might seem like, okay, well, that's a good number, but realize that 50 years ago, the people in this age group had close to 0% type 2 diabetes. And then when they're between 45 and 64, now it is 17%, almost 1 in 5. It's like 1 in 6. When they're over 65, 1 in 4, 24% have type 2 diabetes. So realize that when these people, when the 65-year-olds were teenagers, then there were virtually no people that had type 2 diabetes. That was a disease reserved for middle age and up, 50 and up. Younger people hardly ever had it because it took so long to develop. And when we look at it today, and the youngest group, then 200,000 kids have type 2 diabetes, something that was unheard of 50 years ago. And in the age group 10 to 19, the rate is growing by 4.8% every year. So it's accelerating. It's not just growing steadily, it's an accelerating growth. So when we talk about insulin resistance and diabetes, we need to understand that it's a continuum. It's a continuum of insulin resistance all the way from just having a little bit of extra insulin to the point where your system is completely broken and the sugar is just spilling out into the urine because the levels are so high the kidneys can't contain it. So think about it this way. The green here this is blood glucose, and this is insulin. So green is normal. That means we eat something, our blood sugar goes up a little bit, and then insulin goes up to match it. And the insulin, of course, lowers the blood sugar. That's the purpose of insulin, to guide the sugar out of the bloodstream and into the cells. And then when the blood sugar is normal, insulin comes down to a very low level again. So that would be something like a normal fasting blood glucose of about 80 and a fasting insulin level of 3. But then if we keep eating foods that stimulate a lot of blood sugar, so this is primarily carbohydrates and sugar, then we get higher blood sugar. This is the orange. So now we get greater blood sugar swings, and with higher blood sugar, so instead of normal, the blood sugar would rise this much. Now the blood sugar rises that much. And now we need a higher dose of insulin to guide that blood sugar out. And then the blood sugar comes down and insulin comes down. But it doesn't come down all the way because the cells are starting to become insulin resistant. The cells are saying, hey, we've had too much fuel. And the purpose of the insulin is to drive that fuel into the cell. But if the cell has had enough, it's going to start resisting. So with the green, with the normal situation, we have blood sugar go up, insulin comes up, and they both return to baseline. But with a little bit of insulin resistance, now the blood sugar goes up and the insulin comes up higher, and the blood sugar comes back to normal, but the insulin doesn't. So now we're starting to get insulin resistance, but we can't tell from just looking at the blood sugar. And then we're looking at when we're starting to wear the system out. If we keep doing this for 20, 30, 40 years, and that's why we see these numbers increasing with age, because it takes decades to break the system, unless you're just totally abusing the system, and then you start seeing some cases here even in the kids. Once we start having severe insulin resistance and diabetes, now the blood sugar goes sky high, the insulin goes way high, but even with that super high insulin, the blood sugar still won't come down and the insulin stays up. And that would be the red arrow here. So it's a continuum. Insulin resistance and diabetes are not two different things. They're just different degrees of the same thing. So you go all the way from insulin sensitive to mildly insulin resistant, to moderate, to severely insulin resistant, to full-blown diabetes when you have broken the system, and even with all that insulin, it still can't get the blood sugar down below 180. So now we have sugar spilling over in the urine, and that's where the name comes from, diabetes mellitus or mellitus. And what that name means, diabetes means flow through, and mellitus means sweet. So they used to actually diagnose diabetes with tasting the urine, and if it was sweet, they know they had diabetes. That's before any sophisticated tests. But that's the mechanism, that's where the name comes from. When the blood sugar rises so high that it pushes out through the kidneys, where the kidneys can't reabsorb it because there's just so much of it, then we're starting to totally break the system. Now we're getting kidney damage, and we're getting inflammation, and we're starting to set ourselves up for all these long degenerative problems that result in amputations and blindness and kidney failure. So that's the continuum of insulin resistance. And we need to understand that out of the two factors, the blood glucose and the insulin is the real problem. That first of all, the blood glucose doesn't necessarily change for the first 10, 20 years, but in the long run, it's still the insulin that is the big problem. When we understand that it's not a blood sugar problem, now we can start addressing it. We need to reduce the insulin. We need to stop eating the foods that trigger the most insulin. We need to give the body a chance to burn off some of that fuel before we put more in. And if we understand that, then we unfortunately also understand that treatment is going to make it worse. Because the cell is already overloaded. The cell already has too much fuel. We're packing it full of sugar, the sugar turns into fat, and the cell is bursting at the seams. That's why when it's full, it becomes resistant. But the treatment is aimed at the blood sugar. The treatment is aimed at pushing more sugar into the cell, but it already has too much. So whether you take something that's like metformin that's supposed to make your cell more insulin sensitive, that can help the insulin short term because the cell will allow it in without you creating crazy amounts of insulin, but you're promoting the process of overloading, that you are still making the problem of overloading worse. You're still driving the insulin resistance because you're packing the cell even more. And once the problem is so bad that no amount of the body's production of insulin can keep up, then they start injecting insulin because they think that the glucose is the only problem. The real problem is insulin, and they're treating the insulin problem with more insulin. So even though they can control blood sugar a little bit, they will make your diabetes and your insulin resistance and your metabolic syndrome worse. They'll drive more blood pressure, more cardiovascular disease, and more stroke because the blood sugar is just the effect. It's just rising because the body can't keep up. You got to help the body keep up by not overloading it. And if you understand that, then we get to the number 14 fact that you have to understand is that it is 90+% reversible. There's always going to be a few cases that are just too far gone, but the vast majority of these cases can be reversed. It is an overloading problem of things that trigger insulin, primarily sugar and carbohydrate. And if you stop adding them so much and so often, the body will have a chance to burn something off. If you keep eating sugar and carbs and you keep taking things that will enhance the loading of these things into the cell, then you're going to just perpetuate it and keep making it worse. A couple of quotes to illustrate this. When I looked at the definitions for diabetes mellitus, they say it's sometimes called a sugar diabetes. It's a condition that occurs when the body can't use glucose normally. But what is normal? Is it what we've done for the last 50 years or what we've done for the last 150,000 years, right? So our DNA is way, way old. It hasn't changed in modern times. So whatever our ancestors ate is what we are adapted to. And that was normal. We might have found a little bit of fruit, a few berries, a beehive a couple times a year. We ate maybe 10, 15, maybe 20 grams of sugar per day. Today, the official guidelines tell us that the body is supposed to process glucose normally. That means getting about 70 grams of carbohydrate, which turns into sugar from grain, another 75 grams from fruit, which they say can be fresh, frozen, canned, or dried. They tell us to eat low-fat or fat-free dairy 3 cups a day. They'll give us another 40 grams of sugar. And then they say don't eat more than 10% of your total calories from sugar, that from added table sugar, that's another 50 grams. So 235 grams of sugar or grain, which will turn into sugar in a few minutes. That is probably 10 times the amount that your body is designed for. 10 times the amount that it can keep up with long term. So if you eat this amount, your body can tolerate it. It will take a while before you break your carbohydrate processing machine. And in some people, it breaks after 10, 15 years, and in some people, it breaks after 30, 40 years. But we're on pace to getting basically the majority of the population being diabetic when we get older. So we have to rethink what normal glucose processing is. The body is not defective. It only breaks when we abuse it. The second quote I wanted to mention was, diabetes is a serious disease that can often be managed through physical activity, diet, and the appropriate use of insulin and other medications to control blood sugar levels. This is still the official viewpoint, that it's appropriate to use insulin and medication to control blood sugar. And when they talk about controlling it or managing it with diet, they're talking about eating this kind of diet. So as long as we believe that that's normal and that treating it with drugs and insulin is appropriate, we're not going to change anything. We might lower the percentage of people who have high blood sugar by forcing more of it into the cell, but in the process, we're going to increase insulin resistance, we're going to increase metabolic syndrome, and we're going to promote all the problems associated with insulin resistance and diabetes. So how do you reverse it? I've made several videos that go into a lot more detail. I think you'll really enjoy those. But basically, you want to eat less sugar, less carbs. You want to eat fewer meals. You want to get some exercise, and you want to work on reducing your stress. All those things are factors that drive insulin and insulin resistance. By reducing them, you'll give the body a chance to recover. If you're new to the channel and you enjoy having things thoroughly explained and understand them so you can help yourself to better health, make sure you subscribe and hit that notification bell so that we can keep this content coming your way. And please share this content because most people you know fit into these categories that we've talked about today. And unless you tell them, they may never find out. Thanks for watching.